Okay, so this is Human Movement, week 7. This is week 7, the narrated lecture. This week we're doing sensation, the digit anatomy, and then the grasp. You need to know all the grasps for the student-leds and stuff on the exams, the final exam. The midterm exam. Okay, so let's move into part 1. Let's talk about Gillian Bret, which was the focus of the story this week with Duska and Scott. You need to know this Gillian Bret stuff. There'll be questions on this on the midterm or potentially the final exam. This is probably the only exposure you're going to get to Gillian Bret, I think, throughout the program. Make a little bit in neuro, but not much. And you see a lot of this in therapy. If you're in therapy for a while, seems to be more and more of it. What is Guillain-Barré syndrome? It's kind of a condition in which the immune system kind of attacks itself. In this case, it attacks the nerves, and it kind of causes paralysis, damages the nerves, as you can see in the graphic there. Instance of Guillain-Barré, it's kind of unique in that it hits younger people, 15 to 40 prominently. That seems to be where you see a lot of it. That's most all the people that I've seen have been in that 15 to 40, a little bit older kind of age range. So it's younger folks that get it. They're not really sure what causes it. It's kind of triggered by some kind of bacterial viral infection, generally unknown cause. As in the stories, people just kind of wake up, and sometimes they wake up and they can't move, or they try to get out of bed and their legs just give out. Starts as weakness, tingling the feet and legs, and then spreads throughout the body. Commonly, people are totally paralyzed with it at some point. They may even have to be on a ventilator for their lungs. So it gets towards total paralysis. I've had patients talk about the way they could communicate was through blinking their eyes when it was at its worst. And then it gets better. That's the weird thing about it. Your body starts to recover from it. As they start to get better and they start to regain use of their nerves and their legs and arms, that's where the therapy comes in. Treatments are trying plasma exchange, immunoglobulin therapy, but really no cure for it. Heavy duty therapy, they need round the clock constant therapy until they recover, PTOT. And usually they get a near full recovery, not always. I thought the stories were interesting. We had one case where she got a near total recovery. There's some contractures left in her hand, if I remember right. Whereas Scott, he never got his legs back. He wasn't that motivated either, but he was paralyzed from the waist down. Last time I saw him, he was still paralyzed. He never regained use of his legs fully. Duska, she was the one that was the big focus. She was the young mother with the kids, the lawyer, real high achiever type, go-go kind of person. Kind of like, I would guess, most people as OTs, you could relate to this. Very much multitasker, trying to do it all. What was her personality before the disease hit her? And it's important to know what people were like before they become sick and they see you, so you can kind of see where they want to go, kind of what their goals are to get back towards. Her personality, as I said, very high achiever, career focused, highly educated, a lot of roles she was juggling: mother, lawyer, husband. It kind of hints at that she was having another relationship with somebody at work too. So she had multiple relationships, a lot going on in her life. How did she define herself and get meaning? I think through work and achievements. Achievements were kind of how she defined herself more than anything, I think. And that comes through in her sessions with the OT, I think, pretty plainly if you read the story. How does she relieve stress? I think she always relieves stress by doing more, achieving more, work, climbing mountains, running marathons, that sort of thing. That's how she deals with stress, by really committing herself to some kind of goal, very goal focused. How did that come through in her sessions? She was very motivated and driven to get better. She was like the dream client in the sense that she was just super motivated. If anything, she was too motivated. With Guillain-Barré, there's a fine line between enough exercise and too much exercise. Too much exercise can make things worse, can exacerbate the symptoms, and make the person get a relapse can actually be worse. You have to kind of be careful and hold the person back in her case. Life after that, she lost her roles. She lost her way of coping. She couldn't achieve and work anymore. Really threw her for a loop. In a lot of cases, people have a serious illness like this. They kind of reassess their whole life, and she did, her life values, realized she didn't want to be married anymore. She didn't really want to be a mother. So she kind of focused on, we changed, it was work and her boyfriend versus before when she was the mother and all that. Kind of reset her priorities. In her case, her priorities were not her kids. Her priorities were what always had worked for her, which is work and achievement kind of stuff. The lecture questions. But the lecture questions, I'm not going to answer these at the end anymore. You have to read through the whole PowerPoint. I'm worried people are not listening to and watching all these PowerPoints. So you need to kind of go through these slides to get the answers. They're there, they're pretty obvious, but you need to go through the slides. Okay, let's end this session